Asthma is an inflammatory disease of the airways to the lungs. It makes breathing difficult and can make some physical activities difficult or even impossible. Asthma symptoms occur when the lining of your airways swell and the muscles around them tighten. Mucus then fills the airways, further reducing the amount of air that can pass through. These conditions then bring on an asthma attack, the coughing and tightness in your chest that is typical of asthma. Subscribe. Content created by Healthline and sponsored by our partners. Learn more taking the next step with severe asthma. What do you want to know about asthma? Medically reviewed by Deborah Sullivan, PhD, MSN, RN, CNE, COI on October 1, 2018, written by the Healthline editorial team and Kimberly Holland. Symptoms, causes, treatment, home remedies, bronchial asthma types, diagnosis, prevention in children's COPD versus asthma management, risk factors, asthma and pregnancy outlook. Overview. Asthma is an inflammatory disease of the airways to the lungs. It makes breathing difficult and can make some physical activities difficult or even impossible. According to the Centers for Disease Control and Prevention (CDC), approximately 27 million Americans' trusted source have asthma. It's the most common chronic condition among American children. 1 child out of every 12 trusted source has asthma. To understand asthma, you need to understand a little about what happens when you breathe. Normally, with every breath you take, air goes through your nose and down into your throat, into your airways, eventually making it to your lungs. There are lots of small air passages in your lungs that help deliver oxygen from the air into your bloodstream. Asthma symptoms occur when the lining of your airways swell and the muscles around them tighten. Mucus then fills the airways, further reducing the amount of air that can pass through. These conditions then bring on an asthma attack, the coughing and tightness in your chest that is typical of asthma. Asthma symptoms. Symptoms of asthma include coughing, especially at night, when laughing, or during exercise, wheezing, a squealing or whistling sound made when breathing, tightness in the chest, shortness of breath, fatigue. Cause of asthma. No single cause has been identified for asthma. Instead, researchers believe that the breathing condition is caused by a variety of factors. These factors include genetics. If a parent has asthma, you're more likely to develop it. History of viral infections. People with a history of viral infections during childhood are more likely to develop the condition. Hygiene hypothesis. This hypothesis proposes that babies aren't exposed to enough bacteria in their early months and years. Therefore, their immune systems don't become strong enough to fight off asthma and other conditions. Early allergen exposure. Frequent contact with possible allergens and irritants may increase your risk for developing asthma. Treatment of asthma. Treatments for asthma fall into 3 primary categories: breathing exercises, rescue or first aid treatments, and long-term asthma control medications. Your doctor will determine the right treatment or combination of treatments for you based on the type of asthma you have, your age, and your triggers. Breathing exercises. These exercises can help you get more air into and out of your lungs. Over time, this may help increase lung capacity and cut down on severe asthma symptoms. Your doctor or an occupational therapist can help you learn these breathing exercises for asthma. Rescue or first aid treatments. These medications should only be used in the event of an asthma attack. They provide quick relief to help you breathe again. Examples include rescue inhalers and nebulizers, which are used with medicine that needs to be inhaled deep into the lungs. Bronchodilators, which work to relax the tightened muscles in your lung. Anti-inflammatories, which target inflammation in your lungs that could be preventing your breathing. If you think that someone you know is having an asthma attack, you should sit them upright and assist them in using the rescue inhaler or nebulizer. 2 to 6 puffs of medication should help ease their symptoms. If symptoms persist for more than 20 minutes, and a second round of medication doesn't help, seek medical attention. Long-term asthma control medications. These medications should be taken daily to prevent symptoms. Some rescue treatments, such as inhalers and nebulizers, can be used daily. However, your doctor will need to adjust your dosages. Several types of medications are used to treat asthma. Read more about each one to understand their risks and benefits. Asthma home remedies. Complementary and alternative therapies should never be used during an asthma attack. If not treated properly, asthma can be life-threatening. The following remedies may help with mild asthma, but an asthma attack is a medical emergency. Follow your doctor's instructions and make sure an inhaler is available in case you need it. Coffee or caffeinated tea, a chemical in caffeine, acts similarly to the asthma drug theophylline. It opens up airways and may ease symptoms of asthma for up to 4 hours. Essential oils, inhaling eucalyptus essential oil may ease breathing difficulties brought on by asthma. Lavender and basil essential oils also show promise. However, for some individuals, inhaling essential oils may make asthma worse. Strong smells and chemicals can trigger asthma or worsen symptoms. Mustard oil, this fatty oil, made from pressed mustard seeds, can be massaged into the skin to help open airways. Mustard oil is different than mustard essential oil, a medicinal oil which shouldn't be applied directly to the skin. Management of asthma. In addition to using maintenance medications, you can take steps each day to make yourself healthier and reduce your risk for asthma attacks. These include eating a healthier diet. Eating a healthy, balanced diet can improve your overall health, which may reduce the risks for asthma attacks. In that same vein, research suggests that eliminating processed foods may cut down on the risk of an asthma attack. Maintaining a healthy weight. Asthma tends to be worse in overweight and obese individuals. Losing weight is healthy for your heart, your joints, and your lungs. Quitting smoking. Irritants such as cigarette smoke can trigger asthma. You also put yourself at greater risk for COPD. Exercising regularly. Activity can trigger an asthma attack, but regular exercise may actually reduce the risk of breathing problems. Aerobic activity can strengthen your lungs and help you breathe better. Managing stress. Stress can be a trigger for asthma symptoms. Stress can also make stopping an asthma attack more difficult. Find healthy ways to reduce your stress and anxiety. Nutrient-rich foods are vital to reducing symptoms, but food allergies can trigger asthma symptoms. Get informed on the connection between what you eat and your asthma symptoms. Asthma risk factors. A combination of environmental and genetic factors may contribute to the development of asthma. These risk factors for asthma include race. African Americans and Puerto Ricans are more likely to develop asthma. Sex. Boys are more likely than girls to be diagnosed with asthma in childhood. However, in adulthood, women are more frequently diagnosed with the condition than men. Genetics. Children born to parents with the disease are more likely to develop it. Health history. People diagnosed with certain conditions, including allergies and eczema, are more likely to also be diagnosed with asthma. Age. Asthma can and does develop in adulthood, but the majority of asthma diagnoses are made while a person is still in childhood. Environment. People living in an area with heavy pollution are at a greater risk for developing asthma. Weight. Children and adults who are overweight or obese are more likely to develop asthma.